And then as time goes on, we start to see that aging skin and tissues doesn't look quite the same, doesn't behave quite the same. We start losing that.
None of these treatments are going to lift, they volumize. Even fillers, which we love, don't really lift. They give you volume.
We're injecting your tissues to make the tissues healthier. So you're not going to see volume, but you're going to see a nicer quality to your skin texture, tone, and the appearance.
If you want a non-robust wimpy filler, I still wouldn't recommend PRP. I'd probably recommend PRF. PRP is a little too liquidy. It definitely improves your skin quality, but not going to get much volume or structure from it.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
I am Dr. Kristy Hamilton here with my fellow board certified plastic surgeon, Dr. Roy Kim. We are the beauty scientists, and we have a really exciting topic today, regenerative medicine. So, this is always the hot topic at all of our plastic surgery meetings. It's a hot topic in dermatology. And as we move into this era of more natural treatments, harnessing the power of your own body, we are increasingly having more and more options, and it can get confusing. So, that's what we're going to break down today.
Yeah, this is an exciting topic because it goes into patients' ability to use their own tissue to really boost their collagen and get better facial skin rejuvenation. There's some products that are not your own tissue, but are still regenerative, they're biology based. And it'll be exciting because we're already using some and there's a lot of future application. So, Kristy, how would you define regenerative medicine?
These are a class of any medication, whether it's a body derived or something off the shelf, where we are stimulating or we are encouraging the power of our own bodies to heal ourselves. So we know if you look at a baby, a child, someone like pre-25, their skin is dewy. They've got tons of collagen elastins. The growth factors are pervasive and many. And then as time goes on, we start to see that aging skin and tissues doesn't look quite the same, doesn't behave quite the same. We start losing that. But we know that our cells are capable of creating really healthy, beautiful tissues. So regenerative medicine to me is about harnessing those powers and using materials and medications that are going to help stimulate our body to be its best self and act like its best self. How do you see it?
I totally agree because a lot of the stuff we actually get it from patients. Some of it is human derived. In other words, not from you personally, not from you as a patient, but they're biological based and they really help with rejuvenation. I mean, first up is sort of the granddaddy of them all, PRP, platelet-rich plasma. So for the consumers out there, we actually take some of your blood, spin it or centrifuge it. Sometimes it has to be placed in specific blood containers, the vials, and it's used in facial rejuvenation. So how do you use PRP?
I agree. This is like the original concept born out of, I think, popularized by the orthopedic literature. So they've used that for a long time, like injecting joints, like trying to stimulate in improvement in musculoskeletal health. And so from that, we were like, well, I wonder if it's going to help improve hair, help improve skin quality. And so this was, to me, the original regenerative medicine treatment. And we've injected, I've done it a million times into my scalp to help improve hair growth, which for me was very helpful. And then also injecting into the face. So we're in this era of filler fatigue. And I mean, it's not the topic of this podcast because I think filler definitely has its place. But this is not for structural changes to your face. To me, we're injecting your tissues to make the tissues healthier. So you're not going to see volume, but you're going to see a nicer quality to your skin texture, tone, and the appearance.
Next up, of course, is like PRF because that can actually give you structure. So it's similar in concept. We take your blood, we spin it. We have to spin it in slightly different vials or blood containers, but platelet-rich fibrin, PRF, or injectable PRF, how do you use it?
So the non-structural one that's not turned into a gel, I view that as more like a slow release of growth factors, so like super powered PRP. And so we find that it's like PRP on steroids is how I like to describe it to patients. And I'm placing it in the same places that I describe for PRP. Where does that fit in your practice?
I mean, same, because PRF that's not very gel-like. It's not going to give you lots of structure like filler, but it will give you slight structure, but it's slow release.
Hmm.
And then
And
for the
so
injectable PRF, I think it's a better like volumizer.
yes, that's kind of I position that to patients. So for people who want tear trough augmentation, a little bit of improvement in the volume in their cheeks, it's like certainly not a filler level or fat transfer level volumizer, but it's something that can be built on over time. And I find it's especially nice in the tear trough area, which is an area that, historically and even currently has been a little problematic with filler and clogging the lymphatics. So since it's your own tissue derived, I think that's a really nice option in the under eye area. But I've injected that all over my face too.
Yeah. And then it's not great, in my opinion, for jawline, for resculpting the mandible, for really big structural changes. Been your experience?
I agree. It's not like a powerful, it's not firm enough to provide that amount of projection. I don't like it when people call lift because none of these products or fillers lift, but they do project tissue. And so I think if that's what patients are seeking, like a really chiseled jawline, they're really deflated in the cheeks, then I'm going to direct them to a different type of product.
So what's hot, which I learned about recently and sounds like you're using because you talked about this before the podcast, is PDGF. So this is stuff that's actually derived in a lab, but it's growing human PDGF, platelet derived growth factor. So how do you use it?
So I think it's cool, right? And I think it takes the PRP concept and I think it supercharges it. So you and I know from wound healing, because plastic surgeons are experts in wound healing, when you cut yourself, an injury, whether it's accidental or surgical, that first cell that arrives on the scene is the platelet. And then the first thing it's going to release is platelet derived growth factor. And that is basically like the beginning of the cascade of a number of signaling cells to come, signaling all sorts of healing. And so it's the thought behind it is that with this one platelet derived growth factor, this one growth factor, we're stimulating the release of many more and really, really getting the body to work on healing itself. So it's FDA approved in wound care and wound healing, and now has this topical indication. So that's something that I've started utilizing in my practice, and the early results with patients, people have been really excited. It comes in these little glass syringes, and you can either mix it with like a very, very dilute kind of watery hyaluronic acid, and either apply it topically or inject it. You can also just mix it with saline if you don't want the hyaluronic, depending on what you're doing with it. But it's been very, like my early experience with it, it's been really exciting. So I've really liked it for around the eye area and then also for post microneedling or laser into the skin, because I think that combination of a little bit of hyaluronic paired with the regenerative medicine capabilities is really nice for like texture and tone.
That's good. I think another cool thing about the product, honestly, is like it is human PDGF, but it's not from cadavers. It's not from the patient. They actually force bacteria to grow tons and tons of this chemical, package it, ship it out. It's fantastic.
Yeah.
Yeah.
Super clean. You don't have to worry about it. I think so. PDGF is that's like kind of, I feel like that's going to be a next level result. And then one that we've talked about before, also exosomes. And so, how does this growth, like, how would you explain the difference to someone between like an exosome versus a growth factor?
I mean, technically they're different because, as you know, exosomes for the consumers out there, it's sort of like a van from your postman or postwoman that delivers a bunch of packages, like dumps them at your house. And so these packages are filled with growth signals. They help, they sort of like tell everybody in the neighborhood, hey, we're about ready to grow. And they're derived from stem cells. So they really help with skin texture. They help with regeneration of your skin, and it recruits your own cells to actually start, hey, let's show up at this house and let's start rebuilding it again. I think the disadvantage in the US is that we're only allowed to apply it topically. Studies have shown that injected, it's way more effective, but we're not supposed to inject it in the United States.
Yes, and so that will be lagging behind a little bit as it often is here. We'll benefit from the research from our colleagues globally before we start doing that. But yes, I think like the criticism sometimes of exosomes is like, okay, great, they're delivering all these packages, they're delivering all these messages to the other cells. Do we know for sure what message that they're delivering? So that's the question. And the proponents will say they're delivering hair growth and collagen stimulation and elastin stimulation, but that's yet to be proved. Although I think anecdotally, when you talk to people that are aficionados, like they see all of that. So the PDGF on the flip side is like it's a very specific messaging because it's one growth factor, and we know very well like what that cascade and what that pathway looks like because that's kind of a basic component of our training as physicians. So somewhere in here, I think we're seeing like a really interesting like intersection of these regenerative medicine types. We see like the originals with the PRP and now with the exosomes and the PDGF. And then you were mentioning with your recent return from a meeting in South Korea how they're even harnessing like directly the power of stem cells. So I know internationally that's popular. Can you touch on that for the purposes of this podcast too?
Yeah, I mean, they're using amniotic stem cells, which is not just exosomes. In other words, not just sort of the chemical messenger, but the actual stem cells themselves from the amnion, from the placenta. And so that's going to have a bigger effect in rejuvenation. And I don't know if we're there yet in terms of what we can do in the US, but I do think that's the goal. I think another goal, which we could talk about in a moment, is what do you think the future is of regenerative medicine for like products? Because right now we have some. I'm excited about maybe more products like getting your own blood or getting like skin graft technology, but getting it from you as a patient and then, hey, sending it to the lab and getting it back, but you get back your own aesthetic product.
We were talking about that in prep for this. It's like just like if you know, God forbid, someone has a burn that covers like most of their body and they don't have any skin to transfer to heal. There's actually labs that will grow that surface like skin cell, the keratinocyte, and then you can like apply it in sheets just by like cloning your own skin. So also like goes, you know, you can imagine cloning like the healthiest version of your stem cells or something like that. And it's truly like tailored to you. Or maybe we're testing you out and we're seeing overall your skin is a little bit deficient in maybe these specific growth factors that are really important in collagen production and elastin production. Wouldn't that be? Or these like will, you know, stimulate your fibroblasts to do the work for you. So I think the treatments will get increasingly tailored to the individual as time goes on, and that's going to be exciting. One question we get, because you know, I feel like when you come in for injectables, we know when you come in you get Botox or Dysport, the neuromodulators, you're like, okay, so you'll start seeing something in a couple of days, be fully kicked in 2 weeks, lasts for a couple months. Filler, a little bit of swelling, but kind of what you see is what you get. How do you describe the expected result of these treatments, and how frequently should you be planning on receiving them if you're a patient?
Yeah, I think the best candidates are probably people who want to go as natural as possible. And they also want to see subtle to moderate results in terms of better quality skin. It's not going to give you that much structure. So for structure, you do need to use fillers, fat grafting, something more of a procedure. If you want something that actually improves the quality of skin and yet it's still your own tissue, I mean, regenerative medicine is the way to go. And also, if you combine it with laser, microneedling, like a procedure that's, you know, slightly invasive, it's definitely not surgery. You're going to not just get better results. You're going to actually probably have less pain, recover a lot faster because the healing agents, the healing lotions, if you will, are your own biologic materials.
Yes, and we see like pairing any of these topicals with laser resurfacing, microneedling, like you're shaving days or a day off recovery. We've demonstrated, actually, one of my colleagues wrote a paper on it, how if you mix PRP and, you know, arguably some of these other ones, but she proved that if you mix PRP in with fat when you're grafting it, it has a higher retention. So I agree with you that there's like a lot of synergy between some of the surgical or more invasive things we're doing and these topicals. To me, I view them as the cherry on top and like another component. I don't really view them as like in lieu of Botox or fillers or surgery. To your point, I think this is something where we really want to maintain and enhance our tissue quality. And I think these treatments kind of go hand in hand with your lifestyle in terms of how are we functioning on a cellular level, and diet, lifestyle, that's all going to influence this. And again, these exosomes, growth factors, all of that, I think are playing a role as well as peptides. Um, so to the patient, we're going to do rapid fire questions because we get asked, I know I get asked these questions, so I'm sure you do too. So can I do PRP instead of filler? Dr. Kim, 30-second response.
If you want a non-robust wimpy filler, I still wouldn't recommend PRP. I'd probably recommend PRF. PRP is a little too liquidy. It definitely improves your skin quality, but not going to get much volume or structure from it.
More of like a PRF easy gel, something a little bit more structured, but will still be a softer result, and maybe expect to do it monthly a couple times. And then Dr. Kim, well, I want these treatments will lift my face, right? They'll go up to the ceiling.
None of these treatments are going to lift. They volumize. Even fillers, which we love, don't really lift. They give you volume. And to get a true lift, I mean, honestly, you probably need surgery to get an actual lift. But these things will definitely help volumize things. They'll actually help to improve your collagen in your skin, will improve the surface. Your skin surface is going to look better, but also the skin underneath is going to be a lot better, thicker, more youthful.
So it will help prepare you for your facelift. Yes,
Yes.
and you'll have a better result. And where did the exosomes come from?
Honestly, they should be derived from youthful things. So specifically, a lot of the stuff that is maybe in lotion form is from not just animals, is from the baby animals. If it's exosomes from humans, they're typically from fetal tissue. That's where we get exosomes from.
And that makes sense, right? Because that's the type of messaging that we're trying to copy. We want to copy the messaging of someone who's got great quality skin, which is a baby.
That's right.
Um, and if you're a patient considering starting to incorporate some of these treatments into your regimen, what does a regenerative medicine regimen look like with you?
With me, it depends on whether you're getting neuromodulators, fillers, as well as consistent microneedling or other facial resurfacing treatments. So this is not something that you necessarily need to get like once a month. It can be combined with your normal routine of aesthetic enhancements, and you can get it all at the same time. The reason why it's safe is, of course, it's from your own natural tissue, but certainly for procedures, it'll actually enhance healing. Your healing will actually be faster. So if you're doing it consistently, I do think it can be used in combination with other things. How do you your patients when they want to incorporate sort of regenerative treatments with their overall skincare plan?
I agree. I think when patients are coming in, they've kind of done everything. Like we've got good facial structure with other things we've done, surgical or non-surgical. They're already doing Botox. We're doing some lasers. Okay, we're like, how do we take this to the next level and also really like preserve and maintain? Then I think it's something that we're mixing in quarterly. If we're trying to use like PRF truly for volume, I'll tell them that's something that we could do every month, probably 3 times, and then kind of see where we stand out, or they can work on it more slowly and it could be a quarterly experience. And then for anything hair rejuvenation, I definitely recommend doing like a series of 3 a month apart, and then we're usually going to quarterly or twice a year, just depending on what their response is to those treatments.
Yeah, so everything's of course tailored to the patient, but it also depends on, is it skin? Is it hair? Are you getting other treatments at the same time or not? I think it just depends on you as a patient, as an individual.
Absolutely, and that's why you see someone like you or I to come up with a comprehensive plan. And this is definitely like a component of making sure that your skin stays beautiful and glowing.
Well, as a wrap up, we talked about regenerative products, regenerative techniques, where we're using biologics, your own blood, your own tissues to really help recover from small procedures or really to regenerate or rejuvenate your skin. I mean, I think we both believe in these treatments because they're synergistic, as Dr. Hamilton said. They're the cherry on the top. We're not quite there yet in terms of like being able to use this to really have big changes, but we're almost there. I mean, it definitely enhances surgery, enhances skin resurfacing, enhances your skin, both at the surface level and underneath. So anything more to add, Kristy?
I agree. I see like an increasing role for these modalities, and I think they're becoming more and more powerful, and we're increasingly understanding like where to position them. So I would say expect to see more regenerative medicine modalities in your future and in your local plastic surgeon's office.
Yeah, well, that's a wrap. So thanks so much for spending time with me about regenerative medicine. It's a very exciting, hot topic. It's great to see that there are things we can do today, as well as future customized regenerative therapies that are really on the horizon. So thanks for just joining. As always, if you have any questions, comments, please fire away below. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.